Welcome to all of you who have joined us for this episode of Let's Chat About Aging in Your Community. Brought to you by CHATS, Community and Home Assistance to Seniors. We're just very appreciative that you're taking the time to join in with us today. We've got an amazing panel of speakers, and they're actually return guests of ours from previous podcasts that I would encourage you to listen to individually after you hear this particular episode to hear more from them. But we've got a lot of ground to cover, and we're just really excited about this particular episode. CHATS is an organization that serves close to 8,000 older adults and their family caregivers with an objective to provide services and support to enable people to live their best lives in their community as long as possible, and also to support the family caregivers who are such an important part of being able to achieve that objective. Although CHATS is a regional organization serving York Region and South Simcoe, the topics that we discuss are really applicable and relevant across the province of Ontario and, in fact, across Canada. So we're really pleased to have you join us, and I hope that you get as much new information and also have an opportunity to get some great insight as I'm planning to get from our conversation today. We have three guests. The first is Dr. Samir Sinha. Dr. Sinha is actually a geriatrician at Sinai Health System and the University Health Network in Toronto. He's a professor of medicine at the University of Toronto, the Director of Health Policy Research at Toronto Metropolitan University's National Institute on Aging, and a professor of medicine at the University of Toronto and a fellow of the Canadian Academy of Health Sciences. Dr. Sinha is a member of the Government of Canada's National Seniors Council and Ministerial Advisory Board on Dementia that developed, launched, and now oversees Canada's National Dementia Strategy. He also recently led the successful development of Canada's new National Long-Term Care Services Standard. Our next guest is Laura Tamblyn Watts, who is CEO of CanAge. Her multifaceted career spans law, academia, and policy development, reflecting a dedication to impactful advocacy and education. Laura has been able to leverage her expertise to advance the interests of seniors, serving as National Director of the Canadian Centre for Elder Law and as Chief Public Policy Officer at CARP. Her academic role as an assistant professor status at the University of Toronto's Factor Inwatash Faculty of Social Work underscores her commitment to shaping future professionals in the field. Recognized for her leadership with a community leadership in justice fellowship by the Law Foundation of Ontario, Laura's influence is both felt nationally and internationally through her affiliations with global universities. Laura is an in-demand speaker and has shared her insights at numerous global forums, and also last year published Let's Talk About Aging Parents, a perspective on discussing the complexities of aging with your children and other family members. And last but not least, we have Amy Coupal, who is the CEO of the Ontario Caregiver Organization, a charitable group that exists to support Ontario's 4 million caregivers who provide physical and/or emotional support to family members, partners, friends, and neighbors. Amy's a visionary leader with over 20 years' experience in the not-for-profit sector and is very passionate about mobilizing change through knowledge exchange and building collaborative initiatives that positively impact the lives of individuals and communities. The impact of this work is demonstrated through the breadth of direct-to-caregiver programs and services available through the Ontario Caregiver Organization, as well as the early successes of embedding caregiving in the culture of healthcare and the application of the voices of caregivers to influence decision-making at a system level. So thank you, the three of you, for joining us for this conversation today. And I'd like to start off with a question about what you see as the most critical issue facing the subject of aging in Canada today. Why don't we start with Dr. Sinha?
Well, thank you very much, Christina, for having all of us on today's podcast and for posing such a bold question, because I think there's so many different factors that I'm concerned about when it comes to our aging society. And one is just that we don't have the political will and real bandwidth right now to really make the things happen that I think all of us know need to happen now. We started thinking about aging quite seriously back in 2011 when our baby boomers started turning 65. And within 5 years from now, 2031, only 5 years away, that first set of baby boomers is going to start turning 85 years of age. So we're rapidly aging as a society. We were worried about it many years ago. We started to take some steps in the right direction, but there's a lot of fundamental things that the three of us, as your guests, have been advocating for over the years, to not only think about older people, but also those who care for them. And we really need to make sure that we have the right infrastructure so people can age with confidence. They can get the care and the support they need. And they can retire, if you will, or live their final years with financial security. All these things matter, but they matter especially as we age. And so we know what needs to be done. We just need to really, really get moving on these things as well, which ultimately could support the sustainability of our entire healthcare system and many other systems as well.
Thank you. Laura?
The first answer that probably jumped into all of our heads is ageism. I mean, fundamentally, there's always time, attention, and money for things that we care about. I mean, the reality is we don't like old people. I mean, we like old people. Everyone listening here likes old people because that's what we're doing it about. But society actually doesn't like old people. They don't like how they look. They don't like how they smell. They don't like the resources they take or don't take. And they want to change old people. We have this idea of valorization now, right? Oh, the 100-year-old marathon runner, or the 85-year-old that's done, backpacking through the Himalayas. And that sounds a lot like times we talked about women who were able to not be so stupid and stay at home, and were actually able to uniquely work at NASA, and they go back to people with differences in color or any other type of ism. And it's the same social movement. We're somewhere around the valorization stage. So we don't like mostly old people, but occasionally we think a few of them are interesting. The good news is that social movement theory allows for things to get better. We hopefully don't still think that about the other things. And if we can get to a kind of normalization or some degree of comfort about our own aging, then we're not going to be confronted with this sort of social anorexia. Like, we can't look ourselves in the mirror, right? We can't look ourselves in the mirror and confront it. And even choosing that word confronting is probably shouldn't be that big a deal, but somehow it is. Samir, as always, is completely right. And there is no political will in this area. You might get one or two champions, those valorization people, and then they get promoted to something bigger or better, and then they leave seniors behind. So the reality of our own aging as individuals and as a society and as a population is perhaps one of the most important things. If we look at the global megatrends, United Nations global megatrends, aging is right there next to kind of climate change and digitalization and AI and so on. And yet we make decisions about funding, about resources, about people, about our own well-being with this sort of blinkered approach that somehow things aren't going to change or get people say, oh, well, we'll just get more people. Well, that's actually not how people work, right? Like, we need to actually do some planning and thinking. So I mean, the quick answer is ageism, but the nicer answer is I actually think that there is an opportunity to change our thinking from a sort of a can't look at it or feel upset about looking at it to a really hopeful approach. And I'm starting to see some of those narratives tinker through, and podcasts like this help, I think.
I'd like to come back to that point. And I know that there's a podcast series coming up, and Dr. Sinha, you're part of that series with the Toronto Star, focused on, how to live to 100 or past 100. I'm not quite sure of the title, but more of a positive reflection on that.
I think it's Moira's one called, How to Live to 100 or Die Trying, which I think is a
That's
perfect.
it, the Die Trying. Amy, your thoughts?
Well, I might try and bring Samir and Laura's perspectives together, because I think there's two real challenges that we saw last year that we continue to see as we move forward. One is people don't have a plan. People do not have a plan for plan A, let alone the curveballs that life may throw you around plan B, C, or D if it's needed. And I think that it ties in with what both Laura and Samir were talking about in terms of our discomfort related to having those conversations, which often need to happen over time and involve many different facets of health, well-being, finances, legal, and the fact that they don't have a plan, I think, is one of the reasons why we see growing rates of caregiver burnout. And that would be the other thing that I would highlight. Caregivers are on a day-to-day, week-to-week, month-to-month basis feeling like they are at the end of their rope. And caregivers are feeling like they cannot keep going in providing the physical and other types of supports that they provide for the person or people that they care for. And this has a huge knock-on effect in our families and our communities, but also on our healthcare system. Because when caregivers can't keep going, sometimes they can't continue to go to work. Sometimes they show up at the ER with the person that they're caring for because they feel like they don't have any other choice. Sometimes they face their own health and wellness issues themselves. So having a plan is sort of step one in being prepared for what life may throw at you as a caregiver, but updating that plan over time based on how things are going and what the needs are and how they're evolving is something that we need to do. And then caregivers need support. They need support in order to not get burnt out, because we simply can't do this alone.
Mm-hmm. I've heard several people suggest that we're not just headed to a crisis, but we're already in a crisis in terms of that caregiver burden and just being overwhelmed, burnt out. And without caregivers, the cost to the health system would be substantially more significant than it is now. Dr. Sinha, from your perspective, working as a geriatrician, how do you view the challenges that caregivers are experiencing, and are you hearing any true response from a policy standpoint, a recognition of that in the health system?
Yeah. So Christina, when it comes to caregiving, and from what I see in my practice, I think, there's a lot of things that Amy was just sharing that I think are really important. Is that for all of us as a society, we need to think about aging, and as Laura was saying, we have to look in the mirror and realize that, first of all, no matter what we feel about it, we are all aging, right? Every day that we wake up, we're one day older. And so this is something that's going to inevitably happen to us. And so we need to have a plan. We need to think about, how am I going to look at that? And we're now realizing that the earlier you start thinking about this, you can really positively impact, your aging journey later, for example. That includes, making sure that you have the right supports and services around you. So I think it's remembering that there are things that we can do to try and stay healthy and independent for as long as possible. There are things that we can do that can help us reduce our risk of developing dementia, for example. But there's also things that we can start thinking about, so that we're not just kind of trying to just live in the moment, but also saying, hey, I might actually live to 100 years of age. So am I thinking about putting away a little bit if I can, so that I actually have some of that financial security that I might need? And then also, how do I make sure that I have the right social networks and supports around me, so that I might actually have people who might be available to support me, if I need care as well. Because I think what I tend to see in my practice increasingly are people who haven't, as Amy was saying, made that plan, haven't, prepared adequately. And so they're now caught in the middle of a system that's also not prepared for them, and governments that haven't really kind of put all those things together in a nice kind of package that makes it really straightforward to what we should be able to do. So a lot of the work that I do as a geriatrician is often problem solving. It's identifying what are these issues in front of us, and then how do we make sure that we can deal with the medical issues, but then also get people connected to groups like the Ontario Caregiver Organization, the Alzheimer's Society, to get those supports. And sometimes I have to actually act a little bit as a financial advisor, when people are saying like, we're not sure how we can afford or what we can do. So I have to help people navigate a system that's not really explaining itself well to people. So there have been things that have been happening. I think Laura and Amy and I would all agree that there have been things that we've all been advocating for, and the things that have been happened over the last decade or two. But I don't think that they're done in a way that coordinates between levels of government and makes it really clear to an older person or a caregiver or anyone around them how exactly to go about navigating the supports and services that one might need, as they age. And I think that's where we can do a lot better, so that we don't have people who are as overwhelmed and stressed out and not sure how they can manage through things.
Mm-hmm. Yeah. What are your thoughts on that, Laura? Oh,
when we're thinking about the things that we can easily do, the good news is actually there's lots of them, right? Sometimes we have to think about, are we addressing the issues today at 50,000 feet, which is fine. We actually do need that. That's kind of the ageism answers and the system issues and frankly, the caregiver answers. But every one of those has little things that you can do. And I'm not a big fan of New Year's resolutions, but I do think that if you can make it easy for people, and that's politicians and policymakers, as well as you or your mom, it helps. Like, there are some simple things to do. Get all your vaccines. It sounds so obvious, but you would be astonished to know what a huge difference it's going to make, not just to you and not just to your care supporter, because both of you are going to need it, and also the grandkids who are running in from school with all those lovely germs, right? But it also makes our healthcare system function better, because now people aren't coming into the hospitals for things that are vaccine preventable diseases. Now we don't have, additional strains and supports and more pharmacology associated with people who have now deconditioned in hospital because they ended up in hospital with a vaccine preventable disease, or they additionally need home care. 1 in 6 people afterwards will need home care, or they're going to end up in long-term care. So getting your vaccines is really a super easy thing, but is a really manageable thing at every single level. The same thing is, I usually say, like, don't fall. And it sounds obvious, but the effect of falls is so profound. It is cold out and slippery out right now. I had a conversation with my mom yesterday. She says, I haven't been out in 10 days. And she hasn't been out in 10 days. That doesn't mean just that she's now, not out for other reasons. She's only out because she's afraid of falling. And she's right to be afraid of falling. But that also means our buildings and our codes could have better requirements around accessibility. People say, oh, how do we age in place? Well, how about we build things where people don't have to go up and down slippery stairs? How about we make sure that there's, good double handles or double requirements for handrails on everything. These are things that have been done in Europe and they can be done here. And that goes all the way up to policymakers as well. So when I think about these things, I think about them as, what are the small steps that make huge impacts on people's lives and the system as well?
Mm-hmm. Yeah. There was an Aging Well article in the Globe and Mail back in November. I don't know if you're familiar with that talked about longevity and super agers and what some of the factors are in super aging. And they identified 2 communities, one in Lunenburg, Nova Scotia, and the other in Parksville, BC, as areas that have a significant number of super agers still living independently. And of course, we often hear of these studies that show 99.9% of people want to be able to live in their own homes and live independently as long as possible and not go into long-term care. But one of the interesting comments that was made in this particular article was that whether you're born in a place like Lunenburg or move somewhere such as Parksville later in life, longevity experts say where you live can matter just as much as genetics. And the advice from one person is, if you want to live longer, don't try to change your behavior, change your environment. What are your thoughts on that, Amy?
Well, I will leave it to experts on those types of things to comment on that. What I will say is that we know there are practical things that people can do wherever they live, and that people are making very pragmatic choices to make their aging process as manageable as possible. So I'll use my dad, for example, who is in his late 80s and definitely not going out right now unless I come and pick him up and we go to the grocery store together, which is something that we've agreed to. Normally, he can walk to the grocery store. He's not doing that right now because he doesn't feel safe. I don't feel great about it. So our solution is once a week, we go together in the car. But in the meantime, because we want him to stay strong and mobile, he has a walking routine that he does indoors. So he has his indoor circuit down and around the hall and getting his steps. And even when he was in the hospital a little over a year ago, we were walking every day that he was able so that he would maintain his conditioning. And so I think it's important to look at the pragmatics of your circumstance and to say what is possible and to consider what is possible for the person you're caring for, but also for the caregiver. And I think that's something that as caregivers, we often neglect, is that we will do anything. And I understand that desire a lot within myself, but it has to be something that we can manage with our own physical and mental health needs, work that we do, other people that we care for, parenting or other community types of responsibilities that we have. It has to work for everybody. And so that means for some people, parents are moving in with their adult children, right? We hear about people moving to different communities because that's what makes it work. And so, we all want to be super agers. We all want to live well for as long as possible, but we also need to look at A, what will it take for that to happen? And B, what do we do if we have to make adjustments along the way?
I can talk a little bit about what are that super ager pieces that come. And I actually have a house in a super aging community as well, not too far from Lunenburg. And it's good news that these things are replicable. Okay, there is a little bit about if you can get out and about more easily, if the weather is a bit nicer to you, that is nice. But we live in Canada, and we offset it with other good things. Truly, it's not a warm and lovely place in the winter, and we just have to kind of get past that. But that's true in Lunenburg, less perhaps in Parksville. But here's what people need to do. They protect their cognitive load, not just cognition. So they have to adapt. People who are changing and learning these things often do very well. That cognitive reserve is really important. So if you're doing the same thing over and over again, you play piano every day, you've always played piano, playing piano more isn't really going to help you at a neurological level. Learning the violin might help you, or picking up Italian might help you. You've got to keep sort of driving. One of the great things about those communities that we're talking about is where there are social connections that allow people to learn and explore together. That leads to the second thing. You need to make sure that you've got kind of a physical and physiological reserve. So not kind of what they talk about peak performance, right? This isn't all the marathon runners. These are people that are moving about, they're going grocery shopping, they're walking, even if they're in long-term care, and they're connecting. And where you can connect in super aging communities, physical exercise, even quite light, like going for a group walk, physical exercise with social engagement, that is a winning combination. And we've learned that. The last most important thing that we're really having to emphasize is where people have a service level of purpose. They need to have a reason to get up in the morning, and they need a purpose. Sometimes that purpose is checking on their neighbor. Sometimes that purpose is taking care of grandchildren. Some of that purpose is, working as a lawyer at 95. It doesn't matter, but you need to have that purpose. And so when we're thinking about the lessons learned from those areas, it really is about new things, social connection, exercise, and purpose. And you can do that wherever you are.
One of the things that we hear more about, and certainly Chats has been exploring, is this notion of social prescribing. Dr. Sinha, is that something that you see increasing in value? Is it something that, from a clinical perspective, is being adopted more in practices?
Yeah, I think when it comes to the idea of social prescribing, I think this is a neat concept. I think that's gaining better traction across Canada and other places around the world. And basically, what is social prescribing? It's kind of defined, if you will, as kind of healthcare individuals who are used to, say, prescribing drugs or prescribing treatments, for example. But the idea that often many of my medical colleagues would never prescribe, for example, kind of a gym membership, for example, or access to a museum or another social outing or activity or those sorts of things. And so it's this notion that trying to get people connected to more social and community services and other things that might be beyond the usual health kind of realm, is this idea of prescribing. People who would prescribe various things, now they can prescribe social interventions as well. I mean, I don't think we should think of it just from a healthcare focus. I think there's many people who interact with others who might be able to identify needs and basically say, hey, this might be good for you. And I think the key is it's really recognizing that, just as Laura was describing, when we start thinking about all the different things that we need, we need to make sure that we're staying physically active or need to be socially engaged. We need to make sure we have good access to nutrition, for example. We need to make sure we have financial security. So all of a sudden, groups like Chats, for example, you're often interacting with older adults who might say, I haven't filed my taxes in a few years, right? And you're like, actually, we could help you file your taxes because there's various benefits, for example, that you could actually get. And that's income that helps you buy food, connect with transportation. Some people might say, well, I stopped driving a few years ago and I haven't taken a bus in years. Well, there are a number of communities now, people don't know about this. They have transit training programs where you can actually go to a class where they'll actually take you and show you how to actually get on and get off the bus, for example, how to use that. So again, you have another way of getting around your community. There's so many just different things that are out there that people aren't connected to. And so this idea of prescribing or connecting someone to a link worker, for example, might be a social worker, might be a community health worker, somebody who can basically help figure out what is it that you need, what might you benefit from, and then how do you get those. So it's exciting because I think there's a growing level of interest in it in Canada. There's not a huge amount of evidence to say what exactly is the impact and how can it do. There's studies that are now being developed to try and do that and figure out what's the right way, who can do this, what are the impact of these services. But the key is this is a message about getting people better connected to things that can help them stay healthy and independent for as long as possible. And often it recognizes that it's not just about what you're prescribed as a medication, but making sure that you're connected to a bunch of those different things that can help you age well and with confidence.
Yeah.
So I can build on that, Christina, in terms of how social prescribing and caregivers are such a great fit, because often caregivers are connecting with health care professionals as well as other folks in social care, and they don't need, or it's not appropriate to be giving a medical prescription, but a social prescription might be exactly what they need. So we've been running a project for the last 2 years in 2 different regions in Ontario, where we have caregiver link workers who are embedded with paramedicine, family health teams, community health centers, working with those system partners to connect with and provide those social prescriptions for caregivers. And this year, we're actually adding to our team a provincial link worker. Obviously, one person for the whole province has a lot to do, but it's an opportunity to connect with other organizations who are particularly interested in connecting caregivers with these types of supports. So we've seen in those early returns that this is such a positive thing for caregivers and a way to connect them with the support that they need, not just from organizations like ours, but organizations within the community, other provincial and national organizations that might be relevant to them and their needs. So social prescription and caregiving is a really great match.
Mm-hmm. Yeah. We've talked a lot about connection, this idea that we need to connect people, and we need to ensure that people have support with navigation and so forth. One of the initiatives that Chats is currently working on is the establishment in our region anyway of NORC, naturally occurring retirement community programs. And we're starting in the northern part of the region. We've already launched one NORC program in a building there and have plans to launch several more in the next year. How do you think of that notion of people within a geographic building or area coming together, and I imagine it's not just to support the older adult, but also caregivers, to give them that connection, and to have an on-site navigator for support.
Oh, I want to jump in. I love a NORC. I love it, Lord. It's actually what we just used to call community, but now we've given it another name, right? We're creating connections in communities. And this is an example of those small things that can happen at the individual, local level, but go all the way up. Let me just take home care as an example, right? The way that every individual, let's just say in a high rise, may get home care support. Everyone individually applies for what their needs are. They are all individually assessed at some point. They are all then kind of matched with whatever needs are available. And whatever is available is often dependent on your postal code and how much financing and support and staff they have in that area, right? But there's not any coordination amongst the fact that everyone in that building could have the same team. Right. And so if you're thinking about it from a systems point of view, wouldn't it be helpful if they could do that? And also community can come together. This is also very much the case in rural communities where resources are really often very difficult. If you get, say, a physiotherapist in, maybe privately paid physiotherapist, right? Or augmenting or massage therapist, you can have that person come in once a week for an afternoon or once a week on a Wednesday, and everybody in that little community can take advantage of those services that come to you on a mobile basis. You can do that in an urban environment, but again, rural NORCs are, I think, a massive, massive opportunities. Then there's just that social connection, which we talked about earlier. And where we know is that when people are connected with each other, their happiness goes up, their resilience goes up, their well-being, their physical well-being, trust goes up, and a sense of purpose also goes up. So that's where you get that super aging happening in it. But I got to tell you, just the coordination of services alone from a systems level, it's brilliant.
Yeah.
Yeah, and just building on that too, right? Again, for those who don't know the term NORC, right, it means naturally occurring retirement community, and again, these aren't places where people specifically move to, although there are places like Parksville or Lunenburg where people might move to because they hear it's a great place to age. But these are communities often, as Laura was mentioning, that just naturally become, older. They're naturally occurring retirement communities. About 1 in 4 or more of the residents happen to be older people. So we have even entire cities now, like St. Catharines, for example, is a NORC, for example, because more than a quarter of the population there are 65 and older. But again, it gives an opportunity to say, okay, unlike a regular city that might have a variety of services for people of all ages, hey, we have a exceptional concentration of older people here, older citizens. So maybe there's a way in which, as Laura was saying, we can better coordinate the way we deliver home care. Maybe we can look at programming. And it's not that it's what we do to people. It's also enabling groups to organize themselves, for example. And so sometimes within these communities, a little bit of support to facilitate, can create community-led ambassadors who, again, say, hey, why don't, if there's a lot of us here who would be interested in similar kind of programs and services, maybe we organize kind of our own social activities and supports, ways to get together that then naturally build that community, build that social connection. Might say, hey, anybody else interested in walking? Because we heard Laura, and we know that walking every day is really important, to kind of stay physically fit. We want to do what Amy and her dad do. We want to do all these things together. So how do we form that community and engage that? And so I think that's the opportunity. It's, again, that power of community. It's really enabling kind of things that support healthy aging. And so there are some states like New York State that actually have policies that actually enable NORC programs and those sorts of things. We don't have that anywhere in Canada yet, but I think there's some really exciting kind of work that's being done to kind of promote the idea of NORCs and NORC programs. And so it's one of those sorts of things that, again, it's about how do we support and enable healthy aging.
And that's a bit of the white elephant in the room too. How do we support these programs? There's so many creative ideas and programs that are really starting to show evidence, if they haven't already had that evidence revealed, that could make such a difference to keeping people out of hospital, helping them to achieve that healthy longevity, to reduce the burden on caregivers. And yet, when it comes to policy and funding, that's the white elephant, the funding of community supports and organizations that are providing these services at relatively effective, efficient cost are just not being fully recognized by the funders and the policymakers. What can we do about that?
I mean, I can go ahead and start, and I think this is.
You should absolutely start. Let us know.
No,
that's why I said it's the white elephant, right?
I was doing the healthy pause because I want to make sure that my colleagues, if they want to go first. But yeah, this is a tricky one, right? Because I think partly it comes back to this broader recognition, as a society that as Laura was saying, when you look at the mega trends around the world, we know aging is one of them, and the fact that societally, this is the year that Canada is becoming a super aged nation, where 1 in 5 people is going to be 65 and older, and within less than a decade, we're going to have 1 in 4 Canadians who's going to be 65 and older. That has significant, huge implications for how we organize our services, and there are cost implications if we don't organize them well and efficiently. So this is something it's not maybe it'll happen. It's a trend that it's going to happen. And so how do we get ahead of this? And I think there's a recognition in especially in other countries where they've really looked at this and said, hey, by investing more in home and community supports, things that allow the community to galvanize and build itself and strengthen itself and better support older people living in our communities, and creating age-friendly communities, these sorts of things, that the effects it has on other parts of our spending, for example, like our hospital sector, et cetera, can be significant. Mm-hmm. The challenge is that we're incredibly siloed. And in Ontario, for example, drives me, nuts, for example, that when you think about older people in our society, there's about 3 different ministries plus that represent kind of the needs of older people. There's a Ministry of Seniors Affairs and Accessibility that kind of also represents retirement homes and broad seniors programming. But when you look at people who are living in long-term care homes or long-term care settings, that's under a separate ministry called Ministry of Long-Term Care, which is separate to the Ministry of Health, which often provides a lot of the funding for programs like community paramedicine and home and community care. So all of a sudden you've got 3 different ministries who have to try and collaborate and cooperate, and realizing, hey, if we do this initiative over here, this is going to save you money. But often people don't think about this holistically in terms of how investments in being proactive and upstream can often have significant benefits down the road. And I think that's where, again, we need that political will to recognize there's a lot of great evidence around to support this. A lot of great evidence that I'm sure Amy will say, like better supporting caregivers really helps keep people mm-hmm. in their homes and communities for longer periods. It reduces caregiver burnout. It has significantly beneficial outcomes. So we have a lot of the data, but we actually need to make sure that someone can look at this holistically at a greater level and say, right, where do we need to make investments as opposed to thinking of them as costs that can help to realize savings, or at least the sustainability of our healthcare system and other systems as a whole.
So I would build on what Samir has just said, totally agree around the holistic view and that data-driven view, but we need to not look at these individual data points, but how they're connected. Another piece that I think we can do, those of us who work in organizations, whether that's regionally, provincially, or nationally, is come together and forward with solutions where we model what that collaboration will look like, right? If we show that we can do these things together and hit multiple goals and targets, then I think we can bring that holistic vision to the table with holistic solutions. The other thing I also would call out that caregivers really want is they want to know that if they see something that's working over here, that they can get it over there. And it's really frustrating to hear about an innovative and effective program that I don't have in my community, right? I hear that from caregivers all the time. And so we need to boost those opportunities where we've seen great success and champion them, not only by saying, hey, let's see what that evidence shows. If it's strong, let's move it forward. But how can we actually work together to make it happen in other communities? And I think that's something that as organizations, we can be talking more about in terms of those collaborative solutions.
I think when we're talking as well about, kind of who funds, right, which is fundamentally one of the conversations that's hard to avoid, particularly if you're looking at where investments
Not only
are,
who
right?
funds, but how do you get that funding?
Yeah, this is exactly it. And I mean, I think there's some models that are outside of social structures or outside of even aging that we can see how funding gets raised in different ways. Part of it is you can make requirements on things. So as an example, if you're looking at the EU, if you're looking at how legislative requirements around, say, accessibility have been implemented, they are age ready, right? They are age inclusive when they're thinking about it. And as they are putting in strict requirements around building codes, strict requirements around consumer goods, strict requirements around consumer offerings, so service provision, they're looking at aging and ability and access in a really inclusive way. And so it's not necessarily that the government is saying we're going to give you money. It's in this case, government saying, in order to be in business and make it reasonable, you're not trying to put people out of business, but in order to be in business, these are the standards that we're setting. And that's why I know everybody on this group has been involved in things like the development of standards. If you make standards requirement, that's it. Why are doors this big, not this big? Well, because at one point someone thought this was a good idea, but you can increase them and make them bigger. Then all of a sudden you solve a lot of problems. So sometimes putting it upside down can be helpful. The requirements on there, you just need a reason to make that change in some cases. One of the other things I really want to support the growth of in the aging field, it's just starting in Canada, is the role of philanthropy. I have a friend who is working in advancement and development for a children's hospital. And we were laughing about how hard it was to do fundraising. And she said, I know, like, I just don't have enough people to answer the phone because so many people are trying to give money. Listen, I have kids. I want children's hospitals to be good too. Don't get me wrong. I was sitting with a number of other people working in the fields of aging, and we were just sort of trying to swallow because you cannot get money for older people. It doesn't matter what you try, right? It's just you can't do it. And we're starting to see philanthropy change that. Amy's really in a world of care and care support, and a foundation called the Azrieli Foundation has really leaned into that. We're starting to see like Seth Rogen and others playing around the Alzheimer's world. These initiatives that we're starting to see in Parkinson's and their disease states perhaps, but thinking about aging and thinking about groups of philanthropy addressing this in a not cosmetic way, but in a fundamental mission-based way, I think is a really important piece. And it's one that's been missing in Canada, and it's been growing in other places. And I'm starting to see some of that leadership from organizations, again, like Azrieli's and others that are thinking about it. Connell Foundation as well has been doing some good thinking about it. There's others as well, but that's in the last 5 years. And it cannot be government, right? We have to have a whole of society approach to where resources come from.
But here is the thing that brings all of that together. The folks who have the political will, the folks who apply the philanthropic funds, it always comes with some lived experience. And if you are looking at a very senior decision maker, they will often still say to you, if it's true for them, this is my current experience or my recent experience. And that's why I want to be having this conversation with you now. And so actually bringing forward those real stories of caregivers and activating that sense of, oh, that's me now, or that was me before, or I'm worried that will be me tomorrow, that actually creates that personal connection. And we cannot underestimate the power of thinking about this in your own terms and how that actually motivates people to act, whatever role they might be, whether they can write a check, whether they can influence, whether they can actually, make some change within their own community. So actually really helping people to see, no matter where you are, no matter what age or stage of life you're at, this is relevant to you, I think is really important as well.
Absolutely. And getting at that lastism, right, of ageism, if we can really show that regardless of how old you are, that the kind of commitment to appropriate policies, appropriate accommodations that enable people to live their best lives is in everybody's interest as a community, as a country, something that we really need to aspire to. I would like to thank all of you. The time has gone so fast, as it always does in these conversations, but I really do want to thank you for taking the time to be with us today in this episode. And also thank you for your thoughtful comments. And as we close out, I'd just like to ask you to give us one word of aspiration for the field of aging in the next year.
Start.
Commit.
Empathy.
Thank you so much. Let's get started. Let's commit, and let's do it with empathy. We appreciate so much. We value what you do, your advocacy, your information, your standard setting, your engagement, and surely this is going to make the world in Canada for those super agers and all of us even better. Thank you so much.
Well, thanks for what you do.
Thank you.
And that's the end of this episode. We encourage you, as I said, to check back and see the full discussions that we had with each individual speaker in the past. You'll get a lot more information, and we really value what we're receiving from these individuals in terms of their hard work. So thank you very much. Thanks for joining us, and we'll talk next time.